So one thing I want to talk about in relation to particular football injuries is wrist injuries, and specifically scaphoid fractures. So scaphoid is a small bone in the wrist, pretty problematic when it comes to getting it to heal. The reason I wanted to mention scaphoid fractures can occur um, in any sport. Usually you have a fall on an outstretched hand, so you just fall, you put your hand out, you hyper extend the wrist, and that's one of the mechanisms of getting this fracture. The reason I mention it is because there's a whole subject of scaphoid fractures that you can kind of research why it takes a long time to heal and all these things. But one of the things that's particular to football is that I usually get it's a fairly common thing that a patient maybe in their 30s or 40s will come in and they have wrist pain, and maybe sometimes in their 20s. I get an X-ray and I find that they have an old scaphoid fracture, um, which is in a state of non-union, meaning that it never really healed. And so the question is, okay, when did you hurt yourself? I'd say almost a stereotypical story is there's a football player, 16, he was in high school, he sprained his wrist. Um, it got better over time, but always there's been kind of this lingering wrist pain from time to time. And that's just the common story where you kind of form this uh, non-union or this bone not healing. You kind of live with it because it's not too bad symptom-wise, but ultimately down at the other end is arthritis. It's frequent enough that I see it every year. I see a few people that have that, people that develop arthritis, and so it's just another example of why you have to get these things checked out. These uh, sprains and things like that can lead to things down the road that um, are not entirely predictable, but if I get the story and kind of hear it, I kind of know exactly what's going on and what's going to happen if you neglect it.